Good afternoon. I'm George Latimer, Westchester County Executive. It's Thursday, January 7th, and this is the second Westchester coronavirus update of the week. We are reporting to you twice a week on Mondays and Thursdays. Unless holidays fall into place, we adjust the dates. I want to give you an update of where we are with the coronavirus update, which is outbreak, which has been with us since last March. So we are now entering our 11th month of dealing with this issue. Right now, as I'm speaking to you, President-elect Biden is speaking on national television, and certainly he's addressing the issues in Washington. We'll chat about that a little bit before we're completed today. And Governor Cuomo has some of his key staffers that are giving an update to some of our executive staffers as to what's happening with the rollout of the vaccine. So there's lots going on in our world today. We'll try to be as factual and as direct as we can. I usually start off with the numbers to give you an idea of where we are with the coronavirus outbreak, but I want to put in order of priority the thing that most people are concerned about now, and that is the rollout of the vaccines across New York State, and more specifically across Westchester County, so that you know the very simple question, when can I get a vaccine? Or when can somebody that I love, care about, get a vaccine? When are they going to be eligible for it? It's important to understand right now that this is a process that's just a few weeks old since the vaccines have been approved and are now being out in the marketplace. Each state is getting an allocation of vaccine and then subbing it out to the various local governments, primarily through the local hospitals, into the various jurisdictions. So Westchester County Medical Center, which has been identified as the hub medical facility in this region, is the one that has been tasked with looking at distribution across the 7-county area. Those of us as county executives have been tasked with being involved in that process, being helpful, and trying to help manage and coordinate that process. So Ken Jenkins, the Deputy County Executive, myself, Joan McDonald, our Director of Operations, the rest of our team are now working with the Westchester Medical Center along those lines. The county government itself has received 500 vaccines, Moderna vaccines, from the state this week, and we have been tasked with making sure that people within the county government who fall into the key priority categories have been vaccinated. That would be all of the nurses that work for Westchester County in the public health department, direct contact with patients, also the medical doctors that work for the county health department, those that work in the Department of Social Services that are nurses that have interaction with the client base of DSS, and also some of our county staff people who work in the labs and research department. And the labs and research department for the county includes our coroner function, so that autopsies, things of that nature are part of what that department does, also handling certain kinds of chemicals, testing and so forth. And each of those individuals are also potentially exposed to the virus, so they too are part of the group that will have the vaccines administered to them. We will inoculate that full cohort of individuals, all of which fall into the current phase of inoculations, and whatever vaccine is left after that will go to other individuals that fall into that original cohort. We're going to talk in a few seconds about phase 1 and all those things. But the 1A phase group is the one that's being vaccinated now, and again, that represents doctors, nurses, respiratory technicians, people who are in patient contact in public health settings. It also includes nursing homes and nursing home staff, and that line of vaccines are going through a couple of the major pharmaceutical chains, CVS, Walgreens, and so forth. They are obtaining the product vaccine and making sure they're administered in the nursing homes in and around our area, and then also EMS workers, and that is also part of this situation. We hopefully will get all of that through this particular cohort before we move further. We have a video that shows a little bit about what the vaccination process and the public health process is. So we're going to share that with you right now.
Linda, why are you here to get the COVID-19 vaccine?
I'm here to get the vaccine for a number of reasons. I work in public health. I also have family. I have a lot of friends. I work with a vulnerable population. And I think that in minority communities, there's a lot of fear, and I want to help dispel those fears. It's important to show the community that this is safe, it's going to be effective.
So Linda, now that you received the COVID-19 vaccine, we're going to have you wait in the back with a nurse for 15 minutes to make sure that you don't have any reactions. And before you leave, we'll make a follow-up appointment for your next vaccine.
Okay, thank you.
Okay, thank you.
Thank you.
Okay.
Thank you so much.
You're welcome.
The state has established, I believe I covered this in our last update, but it's worth repeating and perhaps in the future. The state has established different phases for individuals to be tested, and the 1A phase that we're in right now covers those categories that I've identified. The state has laid out a long list of those that are eligible. Federally qualified healthcare center employees, EMS workers, high-risk hospital workers. We talked about emergency room workers, ICU staff, which would mean doctors and nurses, pulmonary department staff, urgent care providers, individuals who administer the COVID-19 vaccines, which include local health department staffs. That's where ours get into the circumstances. Outpatient, ambulatory, frontline, high-risk healthcare workers, any of those who have had direct contact with patients handling COVID-19 specimens as well as vaccinations. And that could be doctors who work in a variety of different situations, private medical practices, hospital-affiliated medical practices, certainly registered nurses, dentists and orthodontists, psychiatrists and psychologists, physical therapists, optometrists, pharmacists, and pharmacy aides. As of this coming Monday, January 11th, that group expands. The targeted group expands to include home care workers, hospice workers, those who are in nursing homes of skilled nursing facilities who have not received the vaccine yet. And in each one of these cases, the people who are going to receive the vaccines must complete the New York State COVID-19 vaccine form. It is available online. You can download that from covid19vaccine.health.ny.gov. And at this stage of the game, that is phase 1A. That is the phase we're in right now. Before we move to the second phase that will follow, which will be a phase that involves what is determined to be essential workers, we are waiting from the state information about when that phase will begin, how many specific categories of individuals will fall into that area. We know that it'll be police. We know it'll be fire. Education workers, which we assume will mean teachers, and those with student contacts will fall into that category. We're sure that bus drivers and a host of other essential workers will fall into that category. And the definition of essential workers will be defined by the state in some greater detail. And with every one of these situations, we are going to see appointments made in order to get the vaccine. It will not be stand online, wait as long as you can until they give out the last vaccine, and if you happen to make it within the cohort of available vaccines, you're in. We've watched that system in other states, in Tennessee, in Texas, and Florida. We've watched it create long lines. They run out of vaccines. People have waited hours and not been satisfied or served. And so New York State is going to avoid that, and we in Westchester County are going to work with them to be able to accomplish that. But where we are today is that vaccines are being given out to those initial cohort of individuals, and we know what will follow that will be essential workers, and that will then be followed by senior citizens and then by the population at large. In order to do that, though, it's an important element to try to identify where will the vaccines be given out and what kind of testing situations do we also have to deal with simultaneously, because we are still testing for COVID positivity, negativity, and at the same time looking at the distribution of vaccines. That is a very difficult dual task. I'm going to ask Deputy County Executive Ken Jenkins to talk a little bit about the location issues that are at hand, and of course, having served as a Westchester County legislator for many years, as chairman of the Board of Legislators, and in other capacities in the public sector, he's very conversant with the realities of the county and how we go about trying to identify locations in the short term and in the long term. Ken?
Thanks, George. And as was stated earlier this week, and County Executive talked about the kind of partnerships that are necessary. In the governor's vaccination plan that they have online that everyone can see how things are going to go and roll out, this opportunity for doing testing is critical in identifying where those vaccines should go. And partnering with the Westchester Medical Center, we've been able to work with Medical Center in doing mobile testing sites, specifically in Port Chester, Tarrytown, Sleepy Hollow, and in Ossining, and we're going to continue to do that work. We've been able to add into them now Mount Kisco and Yorktown. And those particular sites have been working with the local municipal officials, local activists, nonprofit organizations, and all the stakeholders in the community to continue to identify places to be able to do those testings. It's critically important to get to the testing to where the people are. It doesn't matter, we have the state testing site and the drive-through testing sites, both in New Rochelle and certainly at the Westchester Medical Center as well. if you don't have the opportunity to do walk-in and pop-ups and you get the testing to where the people are, that is a problem. And that's why it's been critically important to have that kind of partnership with the medical center to do those mobile testing sites. And again, look forward to Yorktown and Mount Kisco to pop up those particular sites, and we'll definitely let everyone know when those things and where those opportunities are.
Thank you, Ken. And I want to thank Deputy County Executive Ken Jenkins as a partner in all of this. We've worked together as a team, and I appreciate your leadership in all of these things. It's critical for us to accomplish what we need to accomplish. And I want to extend that as well to Joan McDonald, who's our Director of Operations, and all the other members of our executive team, and then down to our commissioners throughout the county government. Let me give you now the update of the numbers that we've awaited for. We have not yet seen the tracker numbers for today, Thursday, January 7th. They usually come out, they had come out previously in the vicinity of 1 o'clock each day. Now they seem to be coming out in the 2 o'clock hour when we're having the update. So you may find that when you go on the county's dashboard, you will see numbers updated that we do not have at the time of the 2 o'clock report, and maybe even as quickly as 20 minutes after we're off the air, you might see updated numbers. You're welcome to check that dashboard at all times. We're trying to keep it as updated as possible, as accurate. We're still lobbying for more information, which we hope will give you more complete information, but we are now transparently sharing whatever data we have with you, the public, and you can now access it at any point in time, the day or night, when you go online. So the numbers we have tracked through yesterday, Wednesday, January 6th, there were 9,597 active cases of coronavirus in Westchester County. As of yesterday, that basically identifies a 2-week cohort of individuals that have tested positive that have not cleared the protocol for 2 weeks. The last time we had as many as 95, almost 9,600 cases was April 22nd. April 22nd, as you may know, was about a month and a half into the start of the contagion. We rapidly expanded up to as many as 12,000 active cases, and then flattening the curve and on the way back down, it took us to late April to be in the same situation we are in today. That should be a concerning measure for everyone. What it tells us is that the virus is far from gone. In fact, it is back, and it's been steadily rising over time. We believe that we're watching an increase generically because of colder weather, more people going indoors, more people in close quarters spreading the disease, but also the spikes that you get from Christmas and from New Year's celebrations, which, although there were no public celebrations or significant public celebrations in those lines, individuals, families, people got together and they did what they thought was appropriate. They did it because they wanted the social connection, and now we're seeing an increase in the amount of COVID. In fact, you can go back almost to Thanksgiving Day and pinpoint how the numbers started to shoot up from where we were. On Thanksgiving Day, we had approximately 1,600 active cases. We now have 9,597 at last count, and I expect that number has shown no signs of decreasing in the last 10 days. We had a period where there was some reduction, but we're back up on the upswing. And the worst number is the number of people that are hospitalized to COVID. The last number we have is, as of Tuesday, 491 individuals, just under 500 individuals hospitalized for COVID. At our peak in the spring, we had as many as 1,200 people hospitalized for COVID, but in the heart of the summertime, we had as few as 30 people hospitalized for COVID. So we have gone from a peak of 1,200 down to 30, back up, halfway up the slope now to almost 500 people, and that is concerning. There's a slight benefit in the fact that our percentage of hospitalizations now versus active cases is less than we had it in the spring, so it's a smaller hospitalization percentage. We're grateful for that. It probably ranges in the vicinity of 5% of the people wind up hospitalized, but the fatality rate continues to grow. We have reached 1,697 fatalities as of yesterday, and we have been averaging any number of fatalities, 3 to 10 a night. The night before last, we had 9 fatalities, Monday into Tuesday. If you go back barely a week ago on Friday night, Thursday into Friday night of last week, which was right into New Year's, we had 11 people die. And those numbers are significant when you look at the fact of how few people were lost over the course of the summer months. I gave this statistic before, so you may have heard this, but I want to repeat it because I think it's a powerful statistic. Between Thanksgiving Day and New Year's Day, we lost 165 people. We also lost 165 people from late May to late October. Late May to late October is 5 months. Thanksgiving Day to New Year's Day is 6 weeks. Same amount of people died in that period, 165 people each time. And if you do the math, 165 people represent approximately 10% of all the fatalities that we've had. So, in round numbers, 10% of all the people that have died in Westchester County have died since Thanksgiving Day. Now, if that isn't a sobering statistic to think about when you think about how virulent the disease is, then I don't know what statistics you need to hear. That basically summarizes what you need to know numerically. We're trying to get breakdowns of fatalities and hospitalizations by municipality, but I am not comforted to know that there are less fatalities in a smaller population community and more fatalities in a larger population community. The fact is that we're losing people to COVID. Some percentage of people who get the disease get sick enough to go to the hospital, and some of the people that get sick enough in the hospital, unfortunately, we go on to lose. When we had our Ribbons of Remembrance ceremony, when we closed down the outdoor ceremony back in the early part of December, and we mourned those that had died, and at that point in time, when we had that ceremony, we had lost, in total, 1,525 people. So from the date of that ceremony to today, we've lost 170 people. Our numbers hopefully will get better as more people take vaccines. So the issue of identifying and delivering vaccine in the various locations, testing people, isolating them, wearing masks, all those things are necessary, because even as you see the light at the end of the tunnel, we're still in a tunnel. And it could very well be that the vaccines will not get into our arms for a good amount of time to come. When we get to the point of vaccinations of broad groups of people, it will be a massive task. And we know we're going to have to do exactly what Ken was describing. We're going to have to get into local areas if we want to fully vaccinate the county. We're not going to be able to do it just out of some major hubs, although we intend to use Westchester County Center as one of those hubs. But you'll apply for appointments. You will not stand online waiting, next come, first serve. It will be online, file a form, have a time, have an appointment, and be prepared for that appointment at that time. And that's the fastest, most efficient way for us to operate. Let me mention that tonight from 6 to 7, we'll have one of our Facebook town hall meetings. We've been doing this since September, after Labor Day. This will be an open conversation on COVID-19. I'm going to be joined by Dr. Charlita Amler and Dr. Dow Hewlett from our county health department. Both of them are medical professionals. Both of them have been at the forefront of dealing with the COVID crisis, and they will be there as people who are knowledgeable in matters of healthcare, so that we can discuss with them the kinds of questions that come up and get a person not who's a generalist or in the world of government, but a person who's in the world of medicine to be able to comment on it. That starts at 6 o'clock right here on the county Facebook page. If you have any questions at that point in time, you can go into our email address, communications@westchestergov.com, and we'll be happy to take that at the time. And we will allocate time for questions in that Facebook Live. We won't get to all of them, but we'll do our very best and try to consolidate questions into single questions so that hopefully an idea can be addressed intelligently. I want to make a side comment of something that we're both very happy about, Ken, myself, and the rest of the executive team. We have a new member who's going to be joining our communications team. She's a familiar face to all of us in Westchester County. Lisa Reyes will be joining our communications team in the month of January. She will bring her diverse years of experience in the media. Of course, we know her from News 12, where she spent 11 years as a reporter and an anchor. And she has also most recently worked in Tallahassee, Florida. She's back in Westchester County. We're glad to have her on our team. We think she'll be a terrific addition. And of course, Lisa, as a Latina, is going to have a particular ability to work on issues that are particularly important to the Latinx community. And we're very happy to have her there working under the direction of Catherine Chaffee, who's really done a brilliant job. I want to mention at this time Emily Lavin, who's been a very valued member of our team, working here in our Central Communications office, will be moving over to our Department of Parks, Recreation, and Conservation, where she will be the communications officer for that department. We have people in that capacity in the police department and emergency services, people with that capacity in the health department, and Emily, who's a fine young lady, graduate of SUNY Binghamton, with a background in communications, did a great job for us here, and now she's going to run her own shop under the direction of Catherine. at Parks and Recreation. So we're very happy for Emily. We congratulate her and wish her well. And we'll be seeing her, and you'll be seeing her, but she'll be the person doing the work for that. And we're very happy to have Lisa with us here. When she joins us, we'll bring her in for one of the updates, and you'll see her in many different capacities. Our communications team does more than just produce press releases. They become sources of knowledgeable information that other members of the press will help us. And as Catherine had experience working for WCBS 880 Radio, Carolyn Fortino, who I might add is doing very well with her new baby, will be rejoining us in a couple of months, month and a half, maybe a little less than that, was a FiOS reporter and anchor. And so Lisa has that on-air experience. Emily had on-air experience, too, in the Binghamton market, and Joe Scamato as well. So we're very happy to have a team of talented people to communicate with the press, because many times Ken, myself, principals aren't always able to respond to the press, so we want knowledgeable, intelligent communications people to be able to give some of those messages that are important. So we welcome Lisa. We'll bring her up here. And also in coming days, we're going to have some press conferences. We're going to introduce some other members of our team. Christopher Steers, who is a commissioner-level appointee. He's been with us now for a little over a month. Former village manager in Portchester, other experience, is going to do a great job for us in directing our administrative activities here, and he's jumped into a host of projects, COVID and other ones, so we'll introduce Chris to you in a format that's appropriate. We have some new people next week that we're going to bring to you, leadership team in the corrections department, in high-level positions, and people who will bring diversity to that executive team. And we're also going to introduce to you a new deputy commissioner in our Parks, Recreation, Conservation Department in a couple of weeks. A popular name in Westchester County, well-known. We're very happy to have him on the county team. But I'm going to tease it a little bit so you can come back and show back in the future. I just want to close our general comments. Obviously, with the incidents that happened yesterday in Washington, I made some comments at the time yesterday from my desk in the immediacy of this. And, certainly in our social media, it's alive with conversations back and forth. I'll defer to Senator Chuck Schumer and other of our national leaders, our new Congress members, Jamal Bowman and Mondaire Jones, to really talk about the scene. They were in Washington. They experienced what happened, the lockdown, the chaos of this insurrection that came into the front door of the legislative chambers. As I did say yesterday, and Ken has had the same experience, we both chaired in our respective days the County Board of Legislators, therefore having served there. I've also served in a city council, and I've served in both houses of the state legislature. When you go into a legislative body to do the people's work, even when you disagree with a colleague, even if you hold a minority point of view, you are part of something bigger than you. You're part of a small d democratic system where we all agree to peacefully resolve our disputes. Now, peacefully can be a heated argument, but it's not fisticuffs. And peaceably is not people crashing through the door, pulling out weaponry, and trying to bully you and threaten you to do what they want you to do through force. The system of American government for almost 250 years is based on the rule of law. And the rule of law says that you have elections, and those elections put people in positions of authority who make decisions. You have rights for free speech and free assembly, freedom of religion, free press, so the government can't run roughshod over you, and people who claim that it is are really just angry because they're not getting their way. I've said many times before, those in the press do not always say flattering things about the things I do. It is not in my authority as a public official to tell them what to write. They write what they want. They film what they want. They edit it as they see fit. And if you don't have a free press, you're one step close to tyranny. If you don't have a free legislative body and all you have is the executive function, one person ruling, you are one step closer to tyranny. And as I said in one of my Facebook posts, in the history of the world, democratic, small d, democracies have never lasted indefinitely. Ancient Rome, there's other examples in the society. This is a 250-year experiment out of thousands of years of recorded human history. And in most cases, totalitarianism, once they got in the door, were able to dominate and take over and take away rights from people. And they did it, with respect to ideas and issues. But at the end of the day, it became about power, the raw use of power. And as I said in that post, totalitarianism is always pounding at the gate. It's always seeking entry. And the first chance it gets in the door, physically or metaphorically, it comes in to dictate to you the terms of your life. And that can't happen on the floor of the United States Senate and the United States House of Representatives. Just can't. And anybody who tries to defend it today, Anybody who says, well, you have to understand they're upset, we all get upset. We all have things that don't go our way. People who run for office understand that you win and lose elections. You know, Ken and I have run for office over a long period of time. We've all had our good days and our bad days. And all the people we know, people who are very successful, have had their good days and bad days. You cannot let any one person's unhappiness over the outcome of an election allow them to soil the overall process. Because what it really is saying is that I don't want to be held accountable. I don't want to be held accountable by the press. I don't want to be held accountable by the legislature. I don't want to be held accountable by the voters. I have power, and I'm not going to let it go. We've already, in this administration, put a term limit, a tighter term limit on the office of county executive, which is acknowledgement that at some point in time, and sooner rather than later, you have to let that power go. You have to be able to let other people exert power. That is what makes a democracy strong. And the debate and the disagreement makes the democracy strong if at the end of the debate you still acknowledge that we're all Americans. We're Americans with different points of view. But when the disagreement becomes hatred, when you work the divisions, when you try your best to make people conflict with each other, you open that gate to totalitarianism. You allow one side to say, I will bring physical force and I will force you to do what I want you to do, as opposed to I will try to persuade you to do what you should be doing. Right here in Westchester County, we have very proximate goals. We have to run the sewer treatment plant. We have to run our buses. We have a jail to be concerned about. We have to provide basic services and social services and mental health, and we have to maintain our parks. We have to do things that are really not that sexy. We don't really have the kind of authority to dictate how people live their lives every day. We have set areas of responsibility. Our job is to do those things as well as we can. That's what we've done today. That's what we're going to do tomorrow. That's what we're going to do next week and every day in between. But we watch the national scene because it sets the tone. And the tone that we've tried to set in this administration and in this government is a tone of cooperation and working together collegially. I know there are people out there that don't like the administration, don't like me personally or the philosophy. I see it on Facebook when people comment, and they comment angrily. Most of what they're commenting about is not even necessarily what I've done. It's that I represent the other side that's in authority right now in Westchester County. And that's the two-party system. You know, the parties tend to go back and forth over time, and over time, if you don't like one administration, if you work hard enough, you replace them with another administration. But to undermine the voting process and to have people bang at the door to try to undo what voters did and to call it a fraud, when in fact it was not a fraud. Judges asserted it was not a fraud. Elected officials in the various states know that it's not a fraud. Members of the political party that lost know it's not a fraud, but you assert it anyway. That's not just playing to win. That's playing to destroy the democracy. And if you don't have democracy, then you shut all of this down. Somebody won't communicate with you to tell you, this is what we're going to try to do. They won't communicate at all. They'll just tell you what to do. And if you don't do it, somebody knocks on your door and says, you better do what's being told or else. You don't want that. I know I was loud, but you don't want that. And if you don't want it, then don't support the people who promote it. Support the give and take of democracy, which is what we're about. I gather we have no questions from the press. Therefore, if anyone from the press does have a question for the press, please feel free to communicate with Catherine Chaffee. We'll follow up with you as quickly as we can. We thank you very much for your patience in listening. Thank Ken Jenkins and the rest of my team. And we wish you a safe weekend. We will be back on Monday to give you the next update and report. We will communicate with you in the meantime if there is anything of an urgent nature. But absent that, we wish you a safe Friday and weekend to follow. And we'll see you on Monday. Take good care.